Well, the growing threat of a drug meant for animals is spreading across the country at alarming rates, including in more rural areas. Pennsylvania tops the list with the highest detection rates for xylazine, according to new research. And North Carolina is second, where 3/4 of new samples of illicit drugs, including fentanyl, contained the animal tranquilizer. Xylazine is present in 1 out of every 9 overdose deaths in the U.S. involving fentanyl. That's according to the CDC. The drug is not approved for human use. Here with us now is Dr. James Besante, addiction medicine specialist. Doctor, it's wonderful to have you. I know in conversations with Nichole, you've mentioned this drug intensifies the opioid high, extends it for longer periods of time. So my question to you would be, are users for the most part willingly taking this drug, or is this being laced with other drugs like fentanyl without them even knowing?
Well, first, thanks for having me on the show and highlighting this important topic. By and large, individuals do not know what substances are in their drugs, and this goes beyond xylazine. We've found different substances adulterating pretty much every drug supply across the country, in rural and urban environments. Most people, unfortunately, just don't know what are in their drugs. It's one of the reasons why harm reduction measures like fentanyl and now xylazine test strips are so helpful, so people at least know what is in the substance they're using.
And what's really alarming about it as well is this drug increases the chances of an overdose, and overdose reversals like Narcan don't work on this. So just how dangerous are we talking?
Well, the situation is bad and getting worse when it comes to overdoses across the country. Unfortunately, the overdose death rate in this country continues to rise despite many campaigns, new funding opportunities, individuals prioritizing this important issue. We're headed in the wrong direction. A drug like xylazine increases the odds of overdose. The overdose rate is so high already with fentanyl. When you take into consideration another drug in the drug supply that increases the risk of overdose, things are getting worse. And it's not just xylazine. The overdose crisis is an evolving crisis, and we're now in somewhere around the 4th wave of this crisis, which is a polysubstance crisis. So if it's not xylazine, it's incredibly strong stimulants mixed in with the fentanyl supply. Across the board, we're seeing more people using more types of drugs, and many don't know what they're using.
Yeah, it's alarming, to say the least. So because this is an animal tranquilizer, I know you mentioned supplies for veterinary medicines are not under the same scrutiny as medication meant for humans. Have there been leaks discovered there, or is this substance primarily coming from overseas?
I wish I had more information for you on exactly where the xylazine is coming from. The most obvious answer is that it is our veterinary supply here in the United States of America, which, as you mentioned, is not under the same scrutiny. I've personally worked with veterinary professional organizations across the country to try to increase awareness to veterinarians, veterinary hospitals about some of these drugs that are being diverted into the human illicit drug market. And certainly they're being incorporated into drugs overseas. As of right now, we're not exactly sure where these drugs are being mixed, where they're coming from. We have some ideas. I think in the next few years, we'll have a better idea of where to intervene to stop the flood of xylazine into our drug supply.
And I know this has gotten worse over the past few years. Can you talk a little bit about the addiction factor when it comes to xylazine, and also some of the severe effects you've witnessed firsthand with your patients?
Mhm. Yeah, fentanyl already is an incredibly addictive substance. It is far more potent than morphine. It is highly addictive, and it's hard to treat. These incredibly strong opioids make our interventions, our medications to treat opioid use disorder less effective. Xylazine, as I mentioned before, most people do not seek xylazine out. In terms of its addictiveness, I think it intensifies the high of other drugs. So individuals may start to seek out xylazine. Right now, across the board, most people do not know when they're using it. I routinely do drug testing on individuals in my clinics, and the vast majority of people I tell a positive xylazine result either don't know what the drug is or didn't know it was in their drug supply.
And I'm assuming this is undetectable when it's mixed with other substances like fentanyl. Is that correct?
Most people do not have a way for testing for xylazine. So historically in human medicine, we weren't using xylazine, we weren't testing for xylazine. In the last several months, several companies have fast-tracked testing strips so we can have point-of-care testing for xylazine. For most send-off confirmation tests, a clinician would need to specify that they want the sample tested for xylazine. So the true magnitude of xylazine is probably underreported because we're just coming up with a way of testing for it or screening for it in a systematic way.
All right. Well, it's concerning. Dr. Besante, thank you for joining us.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.